We have a very large node here, and it's actually not in a typical location. Hi, I'm Dmitry, a surgeon proctologist. I have 7 years of experience. A proctologist is a doctor who treats and diagnoses diseases of the anus, rectum, and colon. A proctologist treats hemorrhoids, anal fissures, fistulas, coccygeal passages, rectal polyps, as well as inflammatory bowel diseases and colon cancer. We have a combined 4th stage hemorrhoid, which is quite an advanced situation. Hemorrhoids are varicose veins located under the mucous membrane of the rectum, about 1.5 to 2 centimeters from the anus. This venous plexus fills with blood and the nodes start to protrude outward, pulling the rectal mucosa along with them. In the early stages, this is felt as discomfort, itching and burning in the anal area. There may be traces of blood on the toilet paper. When hemorrhoids get bigger, for example, in the 2nd and 3rd stages, there will be full bleeding from the anus, meaning a large amount of blood after a bowel movement. It can also be pain and more severe discomfort. In the early stages, we may not remove the nodes completely, but we can cauterize them through an incision in the skin near the anus using a laser, whereas in the later stages, we have no choice but to remove the nodes completely. People are embarrassed not only by hemorrhoids, but by any symptoms related to the anus. That is, whether it's bleeding, some kind of prolapse, pain, people are always embarrassed, they worry, and they come to see a doctor very late. And the risk here is not so much missing hemorrhoids at an early stage, but missing cancer of the rectum and colon. They injected the anus with a local anesthetic. It will start to hurt in about 6 hours. I always take a photo before the procedure so that, first of all, I can show the patient what it looked like before and what we achieved after. Our people, before visiting a doctor, they're afraid or embarrassed to see, often try various folk remedies on themselves. The most unusual of these is to take a cucumber from the garden, break off the tip and insert it into the rectum. A more harmful and dangerous method is to make a steam bath and sit with your buttocks, your rectum, over the hot steam. Of course, you won't be able to cure hemorrhoids this way, but it can result in burns to the rectum. This is a proctological speculum. Basically, it widens the rectum. We use it during procedures. This is an anoscope. I was talking about the small tube that's inserted into the intestine to take a look. Without this examination, a proctological checkup is incomplete. The sleeve is used to actually insert it into the anus. We can't just insert it right away.
Have you ever removed a foreign object from the rectum?
Yes, absolutely. I can't say it's very common, but I do have a few patients a year who come to me with this problem. There were vibrators, there was also a silicone ball for hand training, and there were deodorant caps. So the cases were different. Here's a ball that I removed from the rectum not so long ago. It kept slipping out and it wasn't easy to grab, so I had to use special gynecological forceps. They had sharp teeth and I had to use those sharp teeth to grip the ball and pull it out. Plus it was quite high up, about 8 centimeters from the anus. So the person lost control of it and the ball went into the rectum. I remember a case my colleague had when they removed a 2-liter bottle from the rectum. Actually with not exactly the desired, but you can fit 10 fingers into the rectum. So basically a 2-liter bottle can fit in there as well. However, of course, such large objects will definitely cause significant injury to the rectum. Most often women ask about anal sex, whether it's safe and how to have anal sex properly. Anal sex can be safe if you know how to prepare for it. First of all, you need to use special lubricants, which can be water-based or silicone-based. Of course, before inserting the penis into the anus, it's necessary to dilate the anus with some smaller objects first. For this purpose, you can successfully use sex toys. Anal sex can contribute to problems with the retaining fecal matter. This is theoretically possible, but only if you have anal sex without preparation and do it very often. I remember 2 people came to see me and the woman couldn't walk. According to the couple, during vaginal sex, the man missed and ended up in the anus. And there was significant swelling of the tissue near the anus. I prescribed pain relief therapy and compresses, and basically within a few days the pain symptoms went away. However, it's hard for me to imagine how, frankly speaking, just one wrong penetration could cause such a severe injury. The tissues were damaged within a radius of about 3 centimeters from the anus. Patients most often ask what kind of preparation is needed for the visit. They often ask about constipation because hemorrhoids progress and anal fissures develop against the background of constipation. I had a patient who had been bothered by constipation for 20 years, and naturally, against the background of constipation, he developed combined hemorrhoids. Moreover, there are people who develop a chronic anal fissure over the course of 2 or 3 years. That is, a person has severe pain in the anus for 2 or 3 years, and only after that do they decide to visit a doctor. The case I remember most was when a man came to see me one evening and he had an injury to his anus with a tear in the muscles that hold the stool in the rectum. According to him, he decided to rinse out his rectum using a shower hose. This case seemed very complicated, and I immediately started thinking about how to perform reconstruction of those muscles. That is, it was necessary to stitch the muscles together and hope for the restoration of their function. The function was almost completely restored. The man only occasionally during physical exertion cannot hold in gas, while he is able to control both liquid and solid stool. Proctologists have a sense of humor, they have jokes, and there are a lot of memes about this. I can recall a meme where the sign on a proctologist's office says "Glasses Repair." There was a funny incident after many years of practice. It happened that a girl during an examination was very shy and couldn't relax her legs. The tube used to examine the rectum ended up in the vagina instead of the rectum. Her reaction, well, of course she didn't expect that, but she didn't show it. I don't see any downsides in my work, I'll be honest. Only advantages. The first and most important one, you can quickly help a person who has been suffering from an illness for a long time. The second advantage, it's a very rewarding profession. That is, people appreciate the doctor's work. And if the doctor helps them solve a long-standing, difficult problem, they always thank him. On the one hand, it's the anus every day, and I diagnose hemorrhoids and fissures every day. However, the more you work as a doctor and the more you communicate with colleagues, the more complex patients come to you. That's why there's room to grow further. God willing, may there be enough life to master all the modern interventions. Being a proctologist means using the most advanced techniques to help your patients.